Welcome back to Coast Live, where we're continuing to cover Breast Cancer Awareness Month this October. Today, we're talking about proton therapy, an FDA-approved non-invasive form of cancer treatment. Dr. Vahagan Nazarian is the executive director, I think I got that right finally, of Hampton University Proton Therapy Institute. He joins us now with breast cancer survivor Janet Weymouth-German. Welcome to Coast Live, both of you. Thank you for being here.
Thank you for having us.
So we've heard of proton therapy, and I didn't realize it could be used for breast cancer. So explain how this is possible and why a lot of doctors don't tell you this is an option.
Proton cancer therapy has been available in the United States since 1960s, and as you have already mentioned, it's been FDA approved for over 30 years. It's being used for all different types of tumors: breast cancer, brain, head and neck, pediatric tumors, prostate cancer. So we do particularly well with breast cancer treatments because we're able to almost entirely and completely avoid irradiating heart and the lung of the patient, minimizing or eliminating any side effects associated with the treatment. The reason why a lot of the doctors may not be aware of offer it, because this is a very unique resource. We have been around already and treating patients since 2010, treated over 2,500 patients, but we are a unique resource. We are only center that offers proton radiation therapy in Virginia, and we are only one of 28 centers in the US and one of only 40 in the world. So many doctors may not have experience treating with proton radiation therapy, and surgeons would like to perform surgery. Radiation therapists would like to use the tools that are available to them. But proton radiation therapy has become available to our patients for already 10 years, and we treat a lot of breast cancer patients. So I think the key reason and the key purpose, I guess, for discussions like this, for both the doctors and also patients know their choices and ask about what other treatment options are available if they are prescribed radiation therapy, and consider proton as an option.
So what are the cure rates for this? How successful is it compared to typical radiation?
Typical radiation and proton radiation, as far as the cure rates are concerned, they are the same. What distinguishes proton radiation therapy is that it allows us to be more sparing to the healthy tissues. And then you are talking about cure rates. Management of the cancer requires often complex of treatments that may be radiation therapy combined with surgery or combined with surgery and chemotherapy. So cure rates depend a lot on the complex of treatment that the patient will be prescribed to receive. However, radiation therapy, and particularly proton radiation therapy, allows to achieve excellent control rates, better than 90%. So that's what radiation therapy is purpose in the treatment of breast cancer. First, eliminate cancerous tissues that may be left behind after the surgery, and also disallow its recurrence.
Oh, wow. And Janet, you've been through this. You're what's called a graduate of the program. What exactly does that mean, and how did you come across proton therapy?
Well, I was diagnosed with cancer of the left breast in 2014. I was presented by my oncologist with a treatment plan that consisted of a lumpectomy, chemotherapy, and radiation. And I began to be quite concerned about the radiation, because when they do it with the left breast, it also affects the heart and the lungs, and I've had problems there before. And so, just so happens, my sister had taken a tour of the Hampton University Proton Therapy Institute, and she called me and said, you've got to go take a look. And I think this is a better option for you. I think it'll be much safer. I took the tour, I talked to the staff, the doctors there, and it is amazing. Because what they do in proton therapy, they were able to target the specific tumor and bypass the heart and the lungs and any other tissue. Some people I know who had the traditional radiation, they had over 30 treatments. I had 10. I didn't get burns, I was not tired, I was able to go back to work right away. It was, if you have to go through cancer, that's the easy peasy part.
And you're so positive about this, and you're a graduate, means you finished it, and are you cancer-free?
I do believe I am.
Oh, congratulations. I mean, this is right in our backyard. It sounds like it's a game changer in breast cancer. Is insurance covering this?
Most insurance companies are paying for proton radiation therapy. Sometimes they just pick and choose what they pay for. Medicare pays for all different types of treatments. There are certain insurance companies that will pay for breast, but they won't cover prostate. Most insurance companies pay for recurring treatment. If the cancer comes back, proton radiation therapy often becomes the only choice, so they have to pay for it. And insurance companies also pay for pediatric tumors, because unarguably proton radiation therapy is considered the best form of treatment for pediatric patients.
And you've got about an event coming up. Real quick, tell us about that and where people can learn more and potentially go for a consultation.
On October 25, we have a seminar at Hampton University Proton Therapy Institute, and if you would like to, anybody would like to attend, they should call 251-6800 with 757 area code and come register and attend the seminar. It's an educational seminar that we educate whoever is interested in breast cancer, available forms of treatment, and also about proton radiation therapy. And we do this every other month on a second Thursday of the month. And it's just, we welcome everybody who wants to learn more, be educated more about breast cancer and forms of treatment. We encourage them to participate.
And may I add that a lot of the graduates are welcoming anyone who wants to talk one-on-one about their particular treatment. And I'm open to it. I know a number of others who are as well.
Girl, give me a fist bump.
Woo.
Oh, I'm so proud of you. That's awesome. Thank you both.
It's my
Game
pleasure.
changer. We appreciate it.
Thank you for having us.
All right.